Okay, I'm calling to order the City of Menasha Administration Committee. Clerk Aliazi, can you please take roll call?
Alderman Zielinski. Here. Alderman Grotti. Here. Alderman Benner. Here. Alderman Nichols. Here. Alderman Sevenick. Here. Alderman Collier. Here. Alderman Kruger.
Here.
Alderman Taylor has been excused.
The first item up on the agenda is the Administration Committee minutes from 6/19/17. Is there a motion? Alderman Sevenick.
Mr. Chairman, I'd ask that we hold these for the time being. I am totally in disagreement with how they are drafted, and I will offer an amendment at the next meeting if that's allowable.
Does anybody have any objections to holding the minutes? No? Second. Okay, we have a motion and a second to hold the minutes until the next Administration Committee meeting. All in favor? Pardon?
Postpone them to the next meeting. All right.
Okay, we can just take no action and we'll just redo it in the next meeting then. Okay. No action on the minutes. Next items up is discussion action items. Number one is a professional services agreement between the City of Menasha and Safe Built Wisconsin LLC for the Commercial Building Department Services. Could I have a motion, please? Alderman Sevenick.
I'll make a motion at this time for the professional service agreement.
We have a motion. Is there a second? We have a second. Attorney Captain, can you please explain what this involves? Oh, it can be, okay.
Yep. Thank you, Mr. Chairman. Yeah, so basically, for about the last 8 years, we've contracted with an inspection services company, consulting company called Independent Inspections Limited. So they did both our residential and our commercial building inspection. In 2015, that company was purchased by Safe Built LLC, or yeah, Safe Built. So since 2015, we've been operating under the old independent inspections contract, and really the Safe Built contract, we don't have one with them. In 2016, before I got here, the council decided to reorganize the community development department, get a residential inspector in-house, which we did last month, middle of last month. So kind of made the portions of that old contract that dealt with single and two family plan reviews and inspections, it really made it redundant and actually unnecessary because we have our own inspector. So at this time we would need to enter into a new professional services agreement or contract with a commercial building department company. We have negotiated with Safe Built, formerly Independent Inspections Limited. And so that's what you have in your packets today. And just to give you some real quick highlights on it, it's a 12-month service agreement. It has the ability for an automatic annual renewal unless either party requests to terminate it. The big thing in there, if you look at the Exhibit A, is your list of services and sort of the fee structure. But what it's going to be taking care of, this contract, is all commercial building, plumbing, mechanical, and electrical inspection services, and that the company would receive 85% of the permit fees collected by the City of Menasha. It also has, as requested, residential building, plumbing, mechanical, and electrical inspections. That again is 85% of those fees collected. Backup residential building, plumbing, mechanical, and electrical inspection and plan review services at an hourly rate. It also includes the ability to have commercial plan review and referral services at that same fee structure, the 85% of fees collected. It includes activities and meetings where there are no permit fees generated, so typically pre-permits, and those are at an hourly rate. Has some optional structural engineering plan reviews only at the city's request, and then reporting services that are primarily necessary for reporting to the state, and some of the new reporting to the state that they just instituted. So this new professional service agreement, the fee structure is very consistent with other contractual services we've used Safe Built for, or independent inspections, kind of the same people. for quite a few years already. Their work product is good, very responsive. This one's a little bit more favorable than the last one. Previous had 90% of the permit fees would go back to the contractor. So now it's 85, so we get a little bit more back for the city. But one of the big things that I think is really good about this service agreement, the previous one had the fee structure built into it. So it was basically built into the contract. This contract would allow the council to augment the fee structure as they choose. That's something I'll probably bring forward later for discussion. But that's kind of a big deal. Also, it does allow that 1- and 2-family backup services, which is pretty important in the event that we have circumstances where our in-house inspector may be sick, may be on vacation. And we also have that full service where we could give a project to them from inception, residential, from inception to final inspections, in the event our workload gets too high, or that there's a changeover in staff where we don't have a residential inspector anymore. So this is a pretty good backup service for that. And that's pretty important. And then some of the other services there are necessary. We do not currently have any commercial inspectors or plan reviewers. The state gets overloaded a lot of times, and it's good to have that commercial service in-house. So we are recommending that Administration Committee forward this to the Common Council with a positive recommendation.
Thank you, Mr. Buck.
Sure.
Alderman Sevenik.
Thank you, Mr. Chairman. Can you touch again on the renewal aspects of the agreement?
Sure.
Where is that in the contract? What page? I've been going through it.
That's under page 1, under the term. So from the date the agreement is executed, it would have a term of 12 months, and then it could be automatically renewed for another 12 months unless, with 60 days' notice, either party could not renew the contract.
And how is that renewed? Is that renewed through the Common Council, or?
It would be renewed just as it's written right now. Unless, again, you had 60 days and you decided you wanted to renegotiate or just discontinue.
Why was this written in this manner?
It's a pretty standard contract, so you don't have to bring it back every year if the terms are still acceptable. You do have the option to terminate.
And
So it's really just a way to save the process.
And what happens after the 24th month?
The 24th.
When you're still happy? Just automatic again?
Unless the council is not happy and they wanted to renegotiate. They could let staff know and we can.
Yes, that's the other. Okay.
Attorney Captain, could you please elaborate?
Yes. There also is, if you'll notice, in paragraph 7, there's a non-appropriation clause, so that if the Common Council does not appropriate funds for the following year to pay for a contract for the next year, that it would not be renewed. And otherwise, if it is appropriated, if funds are appropriated for the following year, then it would automatically renew unless we would give that 60 days notice.
Alderman Zelinski.
Thank you. Have we ever, when deciding to find the commercial aspect of the inspections, did we ever consider contacting with Nina or Appleton and work with one of their inspectors if we could do an agreement with them? I don't know if it would have been.
There have been multiple municipalities that were contacted and there was no interest
No interest?
in shared service.
Yeah. Well, they do an excellent job, and it's good to see that they can do backup for if our in-house one is gone. It should work out fine. Thank you.
Alderman Sevenik.
I guess Alderman Zelinski sort of asked the question that I had. I just wanted to add something to that. I don't know why everything is escaping me today. Yeah, I guess he answered my question.
Are there any other questions, discussion? No, on this one, we'll take a roll call vote then, please.
Motion carried on roll call, 6-1.
And moving on to action item number 2 is the request to apply and receive and spend and taking action with date, use of the county environmental health profiles to improve environmental health in the community grant. Is there a motion? Alderman Nichols.
Thank you. I'll move for the approval and forwarding to council of the request to apply for, receive, and spend a taking action with date, use of the county environmental health profiles to improve environmental health in a community grant.
And we have a motion and a second, and could we please get an explanation on it from the Department of Health?
Sure, I'd be happy to. This particular grant is through the Bureau of Environmental and Occupational Health, and basically what it's looking for is innovative ways to address an environmental health issue in the community. We have had the great opportunity of having an intern from the University of Wisconsin-Oshkosh, and she's getting her doctorate in nursing as an intern at the health department, and she basically has been working with us to create a publicly accessible database and to provide lead hazard information to families of newborns, and then to collaborate with medical practitioners in order to encourage them to test for lead levels at an earlier age, and then to look at the idea of water filtration programs for people who may want to have their laterals replaced but haven't been able to do that yet. It would run similar to our radon program, where we sell a kit at cost, and then it's a self-funding kind of a program. This is innovative because it provides for an online accessible database with publicly available information. And the information would include the age of the home, what kind of water service type, what kind of lateral type, and it's really unique because it would also provide the construction dates, etc. So it will take a little time to get this up and going and publicly available, and the funding will help do that. One of the things that I like about this proposal is that currently the CDC and the EPA have lowered the level of what they consider acceptable blood lead level. And we get some tests in, not all tests in, from children. And we're working more on we get a test, we go out and offer technical assistance if it's above the level that's acceptable. This works upstream in that it will be able to give information to families and perhaps work with the practitioners, the medical practitioners, on encouraging blood lead level testing and addressing and mitigating or reducing lead hazards in homes with families early on, maybe even in the prenatal period or before. So basically the other piece that I think is good is it will do a cost analysis so that we can integrate it into our existing public health programs, not creating something new. We have an environmental health program. We have a registered nurse that does work with the blood lead level tests. We also have a public health educator that's very good at not only educating the community, but putting together information in a way that's very helpful to families. We would like to see that integrated throughout the system, but I do need to look at the cost and the benefits of doing so. So that's basically the proposal we would like to offer the state. There are only 8 awards that are given statewide. So, we understand the odds, but we think it's well worth the attempt to apply.
Thank you. Alderman Sevenick.
When you do test for blood levels for lead, is it not just in water? Is it paint and other materials?
Well, that's
that
the
you,
interesting issue that we are faced with. I mean, you hear a lot about water because of Flint, Michigan, and while that is a concern, it's about 20% of the problem. The other 80% of the source of lead is in paint and in dust and in soils. So working with families, if they know the age of their homes and they can work to reduce those hazards and understand, for example, tackling remodeling projects, how that does kick up dust, et cetera. Those are things that we would be available to provide technical assistance on.
Are there any other questions or discussion? Alderman Nichols.
Would this grant also help you develop ways to address the concerns presented regarding lead by rental properties and landlords?
Currently, there is an EPA standard that requires disclosure. So we are currently working with landlords if they're a complaint. We actually do forward that on to the EPA. So that does exist, but we would be able to assist landlords in addressing the issues for technical assistance. We would welcome that.
Are there ways in which those sorts of actions can be required?
They are currently required under EPA standards. So it's a federal standard.
Does that include the mitigation or resolution of exposure?
Notification.
Notification of the existence of lead?
Right.
Once notification has been given, I understand that that's part of the law, disclosure. If a problem has been identified, someone tests very high for lead in the property that they're renting, are there ways to require landlords to take care of that problem?
I was just going to make the point that during remodeling projects, the presence of lead is looked at, and then methods for remodeling or appropriate work have to take that into account. So they have to use lead certified contractors. They have to mitigate affected areas. But that's only during a renovation or a rehab project this time.
So if I'm interpreting that correctly, the health department doesn't have authority to require improvements to occur if lead levels have been found to be high. The only time a contractor or lead safe steps are required is if there's a remodel going on.
We're starting to get outside the parameters of advancing a grant. I mean, it's really important stuff, but I'd like to keep focused on the grant itself, on the advancing a grant to the council.
And my initial question was, are there ways to require improvements on rental properties when lead comes back? They're talking about working with families.
Right.
I'm assuming that means owner-occupied properties, but what about those properties that aren't owner-occupied?
Yep. They're required to disclose, and I'll have to make the clarification for you about whether or not they're required by federal grant to actually mitigate the hazard.
Okay, that answers my question. Thank you.
Thank you. Is there any other questions? All right, we have a motion and a second on the table. All in favor with an aye? Aye. Any opposed? The motion passes to forward it on to the council. I'll entertain a motion to adjourn. We have a motion and a second. All in favor? All opposed? We are adjourned.
Whether it's recorded.